Good afternoon, Daniel. My name is Liddy. I am a nurse practitioner student, and we'd like to do a video, and I need your permission to do that.
Sure.
Thank you very, very much. Today we're going to do exam, and the exam will consist of your head, your neck, your chest. All right? First of all, I'm looking at your head. It is, the contour is fine. The cephalic area is definitely no lesions. I didn't see anything here on this on the outside. We're gonna look at your head, and I'm looking for the texture, which is appropriate for your ethnicity. I am looking for patches of hair that's missing, like alopecia, lysis, dandruff, the distribution of the hair,
Right.
how it flows, and everything looks good. Now I am going to palpate now that I've inspected. Okay? I'm going to palpate for masses, tenderness, any pains.
Nope.
Okay? All right. Thank you.
Thank you.
Looking at your skin is appropriate for ethnicity. You have a little, looks like you might have had a little bit of a bump there.
Yep.
But that's fine. Other than that, I don't see any drooping in the face.
Mhm.
Okay, your eyebrows are symmetrical.
Okay.
Okay, your eyelids are symmetrical. Your eyebrows actually are pretty full, and as your lashes are curly, and full, which is good. Your eyelids are symmetrical to your face, which is good. All right, your nose is symmetrical, as well as your ears to your face. All right.
Okay.
I'm going to check your tympanic artery. Okay, I'm just going to palpate it.
Mhm.
All right. Any tenderness?
No.
All right, great. Great. All right. Now I'm going to check your eyes. All right. First thing I want to do is check the inside of your eyes. I want to check your conjunctiva, which is pink. Okay, and it is moist. Your lacrimal gland is working, but there's not a lot of fluid, extra fluid flowing, which is what it's supposed to do. I'm looking at the medial and lateral canthus. There's no crust around your eyes. That looks like it is fine. Okay. I am going to take a quick look at your iris, and I'm doing that because I want to see its reaction to light. Okay. All right. It constricted when I put the light in it. Of course, most of these exams that we're doing, we would do both sides, but because of time, we're only going to use on one side of your body, all right? So I'm letting you know ahead. What I see is that your eye, your pupil actually constricted when the light hit it. So your pupillary reflexes are good. Okay, they're good. All right? So now I'm going to look and do what's called a red reflex.
Mhm.
I'm looking through your eye. I'm going to get very close up to your face. I'm sorry. Okay. And I'm going to look at your eyes because. Okay. I'm going to look for your macula. I'm going to look for the retinal vesicles in the back. In other words, all the veins in the back of your eyes. I'm going to look for the optic disc. Okay. And let me take a quick look. Okay, everything seems fine. All right, now we're going to check for the extraocular motor movements of your eyes.
Okay.
Okay, we want to see how the eye is actually working. So what I'm going to do is I'm going to move my finger, and I need you to watch directly on the finger and go whatever direction my finger is moving.
Sure.
Don't move your head, just your eyes.
Okay.
Okay? All right? Okay, great. Thank you.
Yep.
Now we're going to look for accommodation of your eyes, right?
Okay.
I'm going to ask you to cover one eye. All right? And we're going to do, I'm going to show you a finger. All right? I'm going to cover the same eye, by the way,
Mhm.
so that you will be able, so we'll be on an even playing field. All right? So you tell me how many fingers,
1,
okay?
2,
then we'll do the opposite eye to see how that was working out. We're going to do what's called convergence, all right? And I want you to tell me when it gets very blurry, just say now, all right?
No. No.
Okay, great, great. We're also going to do one more exam for the eye, all right? When I looked at your eyes, okay, I did see, when I looked with the otoscope, I saw some, I was looking for opacity, okay, also, and there was nothing for me to worry about, so everything turned out okay with your eyes, all right? So we're going to do, I want to do your mouth.
Okay.
All right. What I'm going to do is, I want you to open your mouth for me. Okay? All right? And I'm going to look with the light so I can get a better view. Okay? The palette is soft, light pink. No, nothing, no lesions, no bumps, no exudate at the back of your throat. I can see, I'm just gonna press down a little bit. I can see your uvula, it's midline. Tonsils are slightly pink, but they're not red, so I don't have to worry about you having an infection back there. On the, excuse me, on the side of your mouth, it's nice and pink. I don't see any problem with dentition. Okay, no cavities. All right. Okay. And your tongue, stick it out, please. And it's pink, as it should be. Lift it, please. All right. There's nothing underneath it. There is no lesion, no masses. I don't see anything wrong with that. Do me a favor. Move your tongue around. Okay, I just wanted to make sure that was working out. Thank you very much for that.
Sure.
Okay, now we're going to do your nose.
Okay.
Oh. Any problem breathing?
Nope.
Okay, can you close one nose and blow for me? Okay, with the other? You haven't had any problem with sinuses of your nose? Okay. Your nose is symmetrical to your face. I don't see any lesions around it, so that's a wonderful thing. So now we're gonna go and look inside your ears. All right? Okay, for me to do that, I have to push it up a little bit, okay? All right, there's some fine hairs at the beginning, okay? I'm not gonna push it up too far, don't worry. Septum is not deviated, there's no perforation that I can see, okay? I don't see any nasal drip, okay? Doing good with that, okay? We're gonna check for your ears, all right? Before I do that, actually, I kind of want to check your temporal, the frontal sinuses, any tenderness, any pain, all right? Maxillary ones, any tenderness, any pain?
No.
Okay, great. Do me a favor. Bring down your jaw for me. Okay, now bring it back up. Okay, all right, everything is fine with that for TMJ. All right, we're gonna do your ears. Okay. I'm gonna tug on your earlobe. How's that? Okay.
Okay.
And the piano? Any
Yep,
pain,
okay.
any
No.
tenderness? There's no lesion, there's no mass. Okay, we're doing good there. Adult, you have to pull up and back while you do it. I'm trying to make sure they can see me. All right. There it is. All right, I'm looking up for the tympanic membrane. It is pearly white. Okay, the canal is pink. There is some fine hairs and a little bit of cerumen,
Mhm.
okay, not too much, okay. I can see the cone of light at 5. This is your right ear. Had it been the left, it would have been at 7 o'clock. Okay? All right. Any pain?
No.
Okay. There's no discharges. There's no redness. That is good. Okay. I'm going to cover your ear, your meatus, and I'm going to tell you something.
Okay.
What did I say?
1, 2, 3.
All right. Great. Great. Okay. We're going to do what's called a wet blood test for conduction. All right. And what I want to know is that if you're hearing the sound on both ears, and when it stops, tell me when it stops. Okay?
Okay.
All right.
Okay.
All right. Did you hear it on both ears?
Yep.
Okay. Now we're going to do what's called a renal test. And this renal test is I'm going to hit this, the tuning fork, and I'm going to put it in the back. Okay. Near your occipital, and after I'm going to put it near your meatus by your ear, and I want to know when it stops. Okay? All right.
Okay. Okay.
Okay, no sensorial conductivity loss of your ears. Now, we are going to do your chest. No, I'm going to do your lymph nodes. I want to check your lymph nodes. All right? So we're going to start with your preauricular. I'm going to palpate. We're going to do the postauricular. Okay? We're going to do the occipital. Okay? We want to make sure the nodes are fine. We're going to do the tonsillar. We're going to do the submandibular. We're going to do the submental. Okay, we're going to do the anterior cervical, the posterior cervical, the supraclavicular, and everything seems fine. Now, I'm going to check your chest, okay? Checking your chest means that I am checking to make sure there's no lesion, there are no wounds, there are no masses, all right, that I can see with my naked eye, and now I'm going to palpate, okay? All right, any tenderness?
Nope.
Any pain?
Nope.
Okay, I don't see anything. Any discomfort?
No.
Okay, great. I'm going to ask you. I'm listening to your breath sounds. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay. I respect your privacy. Okay. It's a good thing we have this door closed. Okay. I'm going to check your thyroid. Okay. And I'm going to check your trachea. All right. What I'm also doing is checking your neck to make sure that everything is okay there. All right. So I want you to do me a favor. Would you swallow? All right, everything is fine. I can feel the ridges in your trachea. It's moving fine. No problem swallowing at all? Okay, great. And your thyroid, I can feel them. As I palpate. Okay, between 4 and 6 centimeters. Cool. That's the right size for an adult. Okay. All right. Now, I am going to do what's called a tactile fremetis. Okay. I want you to say 99 when you feel my hands on you.
99. 99. 99.
Okay, I'm getting the vibration when you're talking, and it's supposed to sound clearly as 99, and I'm hearing it that way, which is great, right? We're going to do, I want to check the diameter of your AP diameter, A to P diameter, okay? I'm holding it, breathe in. My hands are moving equally on side, let go. Okay, move in. That's it, great, it's a 2-to-1 ratio. We're doing the there. What I'm going to do is I'm going to look for cacophony, and we're going to do what's called a cacophony test. You're going to say E, all right, so hold on, go ahead.
E, 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 E,
to do something called diaphragmatic excursion. That means I'm going to go underneath your scapula and I'm going to start percussing, all right? And normally we're supposed to do both sides, but we're only going to do one side today, okay? And what I want you to do is take 2 breaths and then let one out, the last one out. Okay, great. I'm looking for resonance, the dull. Okay, yeah. All right, so now what I need you to do is take 2 breaths and the third one, hold it. Okay, we're doing it again. Okay, between where it is, where we started to where we are now, it's about 3 centimeters, which is fine for you. Okay, breathe. Okay, had you been an athlete, it might have actually been maybe 6 to 8 centimeters, which would be fine. All right. Thank you.
Thank you.
Thank you for your time.